So what are the strategy? How do we address it? Should we reduce the duration of DAPT because standard duration is 12 months? Shall we use a safer single antiplatelet, or we go for a de-escalation of DAPT, or we have any specific stent which gives a better outcome if we reduce the DAPT therapy, or we go change over to single antiplatelet? Is there any stent which gives a benefit in this subset, or shall we use DCB as mentioned by Dr. Upul yesterday also? So if you look at the stent characteristic, the two important things which come into factor is the strut thickness. If the thicker is the strut, more is the stent thrombosis. And you can see it clearly. The middle one has the strut thickness of 160. You can see such a high rate of stent thrombosis here. Whereas the moment it is 90 or 81, which is the standard stent sizes nowadays, the stent thrombosis rates are less. Second is the polymer which is there in the stent, which actually holds the drug which is there on the drug-eluting stent. So many times we thought that this polymer is the reason for the higher stent thrombosis, and that is the reason why we have to extend the DAPT for longer. So then came in 2015, this was the first study where they started assessing a patient with polymer-free, that means the BioFreedom stent where there is no polymer, the drug is directly coated on the stainless steel, on the stent platform itself by having some micro holes in that. So there was no polymer. So the moment the drug is eluted, there was no polymer, so there is no chance of stent thrombosis, so there is no need for a long duration of DAPT. But does it give an advantage over the conventional stent? But because this was the first trial which addressed this risk of late stent thrombosis or very late stent thrombosis, and this was the trial which was called leaders-free trial, which came way back in 2015. And you can see here they compared it with bare metal stent, because in bare metal stent we generally use 1 month of DAPT because endothelialization is good. So they thought that if you remove the polymer, then you can think that this stent after the elution of the drug itself will behave like a BMS, and you can use only 1 month of DAPT in this subset, just like a bare metal stent. So this trial, what was the result of this trial? These were the inclusion criteria for high bleeding risk. Here you can see the moment that used a DCS, which is the blue, definitely convert a better primary endpoint, which is clinically driven target lesion re-escalation of only 5.1%. Of course, because it's a drug, so the restenosis rates were less here. What is the safety endpoint? Stent thrombosis, MI, which is the ischemic events. We are using only 1 month of DAPT in a drug-eluting stent. Of course, we thought that probably the ischemia rates should be high, stent thrombosis should be high, but no, it did not happen. The stent really did really well compared to a BMS where only 1 month was given. And here also, even though it was a DES, we still gave 1 month, and still the primary safety endpoints were much more favorable, statistically significant, 9.4 versus 12.9, suggesting that probably a polymer-free stent is the way forward. Then subsequently we had this stent platform was stainless steel, but subsequently they came up with a cobalt chromium stent also and did the same study, which is the leaders-free 3 trial. That also gave the same outcome. The bleeding risks were less. The ischemic rates were almost similar to the bare metal stents. Then this really started encouraging people to think that probably polymer-free is the way to go. Then the other companies which also had their stents, they also started thinking that we have a new generation stent. Can we emulate this result? So the Abbott company came up with the GiANT short DAPT program where they used DAPT for 1 month, that is the 28, GiANT short DAPT 28 and GiANT short DAPT 90, which is giving antiplatelet for 3 months. And what was the result? This is that 90 means the DAPT was given for 90 days, 28 means the DAPT was given for only 1 month, which was similar to like what we do in bare metal stent. So this is the trial design. You give for 90 days or 1 month, and you can see here comparatively both trial almost 2000 and 1600 patient here. Here you can see 1 month, here it was given 3 months. After that we changed over to single antiplatelet, and these are the criteria distribution. What was the age, hemoglobin less than 11, all these HBR criteria were almost there, and you can see here HBR criteria were around 1.5 in the 90 and almost 1.6. So that means more than 1. And this is the antiplatelet use. You can see here the right sided we used only for 1 month, the left side we used for 3 months. And this was compared with historical data of GiANT v CVA where it was given for 12 months. And now you can see here the The all death or MI, with the historical data where they gave it for 12 months and it is only for 90 days, similar outcome. All death or MI in 1 month trial, almost similar data. Bleeding risk, 90 days and 3 months, definitely because we gave it only for less duration, the bleeding risk was less, even though it did not reach statistical significance, but number wise it was less. BRC 3 to 5 bleeding, it was statistically significant. So all bleedings were, even though not different, but the moment you gave shorter duration of therapy, the bleeding risk was much less compared to the standard therapy. You can see here 2.2 compared to 6.3, and in the 1 month one, again it was 2.2 compared to 4.5, which was almost similar. Stent thrombosis rate were almost same in both the subgroups. So concluding that HBR patient undergoing PCI with giant stent with short duration of 1 to 3 months, they really did well with 1 or 3 months of DAPT. It was not needed that you have to go with a 12 months. So this stent again showed that it is not necessary that you need to have a polymer free. You can still, the newer generation of drug-eluting stent, even though they have a polymer, but the design and all this thing is so good that you can still continue with 1 month in a HBR.